We're going to be talking about not the past, but the future. And Lee has just published a book. Book's called
The Age of Scientific Wellness.
Thank you. The Age of Scientific Wellness.
Yeah.
Yep. And those of you who've been tracking Pattern know that Lee was with us at our Splash event when we first came out of hiding or stealth mode. And we talked then about doing some work with Lee on P4 stuff. And now we're way beyond that, and he's way beyond that. And we're going to talk about phenome health today. And what does that mean? And why do we care? And where are we going to go forward from there? We're going to talk for about 20 minutes, pure phenome health. And then we'll have a little announcement to share, and then we'll talk about that. Good to go? Okay.
Sounds good.
Tell us about phenome health. What does it mean, and why do we care?
Phenome Health is a nonprofit I started in 1921 to drive data-driven health forward in an amazing way. And what I'll tell you today are two things. Data-driven health is going to lead to the biggest paradigm change ever in medicine, giving us a healthcare of wellness and prevention as opposed to disease. And it will make every one of you much healthier than you are now, in spite of what you think. And I'll try and convince you of that. So a key idea, of course, in optimizing health is we optimize the potential of every individual. But it's even more than that, and that is the developed nations of the world aren't replacing the lost people by births. And it's going to be key to have that extra health span of 20 years to be actually able to use the wisdom, creativity, energy you have with a purpose toward helping society. So, what exactly is this whole idea of data-driven health? Taking your genome and your phenome, and we'll talk about exactly what those are. But what they allow us to do is to actually interrogate you as an individual and take your own data, one, to optimize your health, and B, to prevent the transfer of disease. And I'll try and convince you we're on the edge of being able to do all of those things. So the important point is we started in 2000 an institute called the Institute for Systems Biology, which took a global holistic approach to thinking about biology and thinking about healthcare. And systems biology turns out to be really key because it can take your own data and it can translate it into the biological networks that underpin health and disease and give us causality, insights, drug targets, and actionable possibilities that let you improve your health. And more than that, it can actually convert the statistical relationships within your different data bits into the different features of data, and we'll talk about those in a moment, and how they're interrelated to health in a way nothing else can do. So systems biology is one part of the key part of analysis. The second part is AI, and I'll talk about that a little bit later on. So we started a company called Aerovale in 2017, and in 15 actually. It went 4 years, 5,000 people. We have the genome and phenome data from each of those individuals. And why is that important? Your genome gives you the potential of the health trajectories you can take. And your phenome is actually the result of your phenotype and how it changes and how we can measure it. And the striking statistics are, with regard to health, your phenome is 90% of it, and your genome is 10% of it. So we have to move beyond the genome, and that's exactly what we're talking about here today. From 6 different data types in the Aerovale data, so your whole genome, 3 types of blood analytes: proteins, chemistries, clinical chemistries, your gut microbiome, and digital health measurements, we were able then to draw some really striking conclusions about health. And in fact, there are 5 major categories coming from these data that can optimize your health in different kinds of ways. So first of all, the genome. Your genome has embedded in it all sorts of deficiencies most people never find out about. We can rectify that in terms of tens of thousands of actionable possibilities in the future. But your genome does more. It determines whether you react with drugs. It gives you the statistical probabilities for your likelihood to carry out, traverse into disease, and it gives us insights on how we can avoid those things, and so forth. And lifestyle, there are 600 variants that actually have to do with simple physical kinds of things like ACL tears. And if you know you have the variant, you can do the exercise to avoid it. I tried to persuade Pete Carroll and the Seahawks that they should do this for all their people. The players were utterly opposed for reasons totally obvious. Anyway, a second area is we can do statistical analyses of all these data bits, and we can map variants in those analytes into these networks and get insights into defects. And we can map them into the communities that say the interrelationship of all those different features in a really unique way. And these lead again to actionable possibilities, drug targets, and biomarkers of various sorts. A third area that's really exciting is we can actually analyze now and create a whole series of algorithms that relate to trajectories of health. We can measure your biological age. We can measure your biological BMI in very accurate ways, much better than the traditional. We've just created a metric for frailty, which is really critical for older people. And finally, we have the ability through organ-specific blood proteins to interrogate 25 different organs within your body and look at state changes. And that leads to a lot of exciting kinds of things. A fourth thing that is really critical is this data showed beautifully in the 5,000 people that there were transfers to from wellness to disease. And we looked in 10 that went on to get cancer and showed in every case from 1 to 4 years prior to diagnosis, we saw beautiful protein elevations that mapped into networks and communities and gave us deep insights into how we can prevent these things. And the simple idea is knowing early your propensity, you can reverse it before it ever manifests as a disease. And finally, together with the Buck Institute, we're integrating in all the features of healthy aging to all the kinds of networks we've talked about here. So this leads to enormous opportunities. And where are we going now? Well, one, we're going to do our studies in the future with 10 to 100 times as much data as we did initially. And that data is going to give us absolutely new approaches to insights. And Mark talked about one in this prospectral analysis. We'll talk about that later. But you can use voice in incredible ways to do diagnoses for optimizing wellness and avoiding disease. And what is absolutely fantastic is you can take a centimeter of hair, and from that you can measure 150 environmental contaminants. And this has been used in Middle Europe to actually identify the locations of people with regard to their environment. So this is, the exosome can be measured in this particular way. We've created a platform that is doing one really important thing, is it's using tools of AI that haven't been mentioned yet today, namely knowledge graphs, where we can connect data to the entire biological knowledge of the world, and 2, digital twins, where we can make predictions from estimates of what your genome and phenome are likely to do for you. And then finally, large language models, or the kind of thing that Mark has talked about, and we'll discuss that again later. And the AI that we're playing with now integrates these tools. And the whole idea is a simple one. We want to be able to take your genome and your phenome and put it in this device and have it give the entire list of actionable possibilities for you and send it to your doctor in a way that's explainable and has the validation clinically, and make each doctor an expert, domain expert in all fields of medicine. What are we actually doing today? Well, 2 major things. One, like Airavail, we're going to expand enormously the population of data-driven analyses of individuals. But equally important, we're going to take a big data approach to all 4 of the major chronic diseases, namely diabetes, Alzheimer's, cardiovascular disease, and cancer. And we're well along with high data clinical trials on the first 2 of those, diabetes and Alzheimer's. And let me just say, with multidimensional data, you can reduce enormously the number of patients you need to make very powerful conclusions, a point we'll talk about a little bit later on. So, 1, we've just received a $52 million grant from ARPA-H to carry out 5 different analyses of phenomics, and we can talk about those. One of them involves the prospectral device, and we can talk a little bit about that later. Number 2, we've started the diabetes and Alzheimer's clinical trials with big data, and we've also started with 420 women a big data trial on pregnancy, and if there's any data desert in human biology, it's pregnancy, and I think that's going to change rapidly. So the other point I would make is, in the future, data-driven health is going to deal with the 5 major complications of contemporary healthcare, and there are major complications in the US. 1, the quality is poor. We're at the bottom of the top 20 developed nations. Number 2, there's a rapidly aging population. 3, chronic diseases are exploding. 4, there is ethical and diversity considerations that really have to do with data, and we can fix that. And 5, there are the cost examples, and I'll argue if we prevent disease at the 50% level for chronic disease in the next 10 years, we're talking about 86% of $4.5 trillion in savings. What's the key to persuading people to do it? In the end, it's going to be economic. So we've proposed to the Trump administration a Make America Healthy proposal where we look at 1 million people for 10 years doing genome phenome analyses, and this will do 4 important things. 1, it'll validate the health for each individual. 2, it'll demonstrate unequivocally that we can avoid disease and make enormous cost savings there and everything. And number 3, it's going to open up new dimensions of data. And I'll argue that no matter what type of AI you use today, it can only interpret in the complex of the data it has. And I'll tell you, human biology is complex beyond belief, and we've only begun to touch the dimensionality of how we can approach that. And I'll just say parenthetically, and don't have time to talk about it, we're talking about a new drug company that I think will revolutionize pharma in the future using peptide drugs. And those peptides, in addition to being drugs, will give us incredibly powerful tools for interrogating human complexity in ways we've never been able to do before. So, what are we going to get from all of this? Three things. One, we're going to have a healthcare of wellness and prevention in the next 10 years or so. Number two, with the driving forward of these technologies, we'll democratize this healthcare. We'll move it into the home where with wearables and things like that, simple devices, we can make all the measurements there. And that opens it up to the poor classes, and it opens it up to underdeveloped countries. And then three, which I didn't talk a great deal about, I think the AI, the kinds of things Mark has done, provide the most singular tools for transforming healthcare in the future, and putting together the best of these and persuading the healthcare system that they should be partners with the enormous opportunities AI presents rather than opponents to it is going to be the key to the future. Okay, we get to go.
Well done. I have learned over the course of the years of our friendship how to do the ultimately perfect interview with you, Lee. I go ahead, Lee. So shall we jump around to do this thing?
You do what you wish.
Okay. We're going to talk, like the friends we are, about a new thing we're doing together. We have already signed an agreement, a master agreement, between Phenome Health and Pattern. And then we just are about to sign, I think, a data agreement between Phenome Health and Buck Institute and Pattern, with the intent of having a number of SOWs over time, and with the focus being the use, as Lee just said, of the prospectral device, which Lee has now purchased, thank you very much, and which will be on site at the Buck, in the beginning at least. And then Lee and the Buck have, with this money he mentioned, done a very complex protocol for a project called the Time Project, which will look at circadian rhythms, and I'll let you talk all about that in a minute, because I think they'd like to hear what that's all about. And then my hope, I think our shared hope, is that what will happen is what was promised in a paper that recently came out of Berkeley National Lab, which I referred to earlier, and that is that prospectral should be best in class as a point-of-care device for diagnostics. And that's a multi-year program. So this is early days for that, but here we go. And what Lee will find with Buck, we hope, is consistent, accurate, new information that can be highly correlated or causally related to other outcomes and to age and gender and what time of day it is and all kinds of different things. So that's my small lead-in to a big project. Would you describe the project for these folks?
Sure. But let me make a more general point that I think is really important. As I said earlier, biological complexity is enormous. And what we need to do is create a whole series of new windows into deciphering this complexity. The one window we've done really well with is blood, but I think saliva is a second possibility, and the prospectral device opens that up. But I'll go on and say I think urine is going to be very important as well. So I see this as a general instrument that can open up new windows in deciphering complexity. And what we propose to do with Mark as the first project in this ARPA-H proposal is to take 130 people who volunteered to, for the first week, come to the Buck and get 5 blood draws per day for a week. They get to rest a week. We do it another week. And then for the rest of the year, we take diminishing samples. And the idea is to be able to look at cycles of analyte expression in the blood, circadian rhythms, short-term, and then intermediate and the long-term kind of rhythms are going to be important. This has never been studied before. And I think the multispectral device is going to be an enormous, powerful adjunct to the multi-omic analysis we'll be doing. And I think the impedance match between the two types of data are going to be mutually reinforceable and I think very, very kind of complementary. So if we're successful, we have a whole series of other partners we're negotiating with, and this could become a fundamental tool for the future in creating new windows into biological complexity, deciphering that complexity, and ultimately, one, transferring it into actionable possibilities to improve individual health, and then two, creating the biomarkers and drug targets we need to manipulate the deficiencies of your genome or your own behavior and environment. So,
exactly, and when we are successful. So there are two layers of tech here too, with the same name in a way. So as you all know, the device it works as well as it does, not for hardware reasons, but because we have the pattern discovery engine at the back end. And so it is the detective seeing the patterns of all these various chemicals that are in the substrate. Without that, it's just a normal spectrometer. So what can happen in this work is that we kind of create the non-tuned device and run everything through that and see how it looks. And then it may well be that the pattern discovery engine, or pattern DE, which we were talking about just now, can do more. And so you can imagine, even after the time project is done, or if there are more and more types of data that are being gathered, the engine can look at any number of sets of data. It's unlimited. And there may be correlations that we can't even guess at right now about geography or pollution in some who knows, but should show up. And so there's once the baseline is done, I think there's an open door there that we might want to bring the engine in on its own and look at the data that Lee's working with. And that would be a separate project, but equally exciting in a different way.
Yeah, I'll just say, well, I think one of the most interesting papers I've read in recent years was this paper 2 or 3 years ago that said, with regard to health, it's 90% your behavior in your environment, it's 10% your genome. That's telling. And with regard to behavior and environment, it's the phenome that measures that. And we're putting together now 3 very large data sets, one from Israel with 12,000 people, one from Turkey with 10,000 people, together with our own with 5,000 people. And the harmonization of those data will give us the ability to interpolate missing values in each of the sets where measurements weren't made, but we can accurately estimate what they would be. And what I would say is this unified global data set is going to be an incredible data system for pattern to look at. So I do agree with Mark. But the other point I will make is I'm actually involved in another 1 million-person project, international in nature, headed up by an individual in Turkey, focused on Asia, and we already have 4 different countries involved in it, and 2 or 3 more are going to be involved. And if we're getting, in the future, millions of genomes and phenomes, that's going to be just an exceptional opportunity to generate the actionable possibilities of humanity from which your genome and phenome can be interrogated to give you the prioritized ideal options for you to improve. And one last point I'll make, if I had to pick out one thing in all the actionable possibilities that we have before us that is really important for healthy aging, it would be exercise. So I was just telling some of you that I did 150 push-ups this morning before I came here. And I think exercise and balanced exercise is absolutely critical. And one of the other really interesting points that I think is really key is, look, if we all live into our 90s and we can be physically and healthy, available, functional, it's really important that we have a purpose. You don't live into your 90s without some purpose. And I would argue tennis and golf can only provide a little part of that purpose.
That was unexpected. I did not see that coming. That was great. Okay, and it strikes me that we're going to learn a lot. We're going to have a lot of fun here, and that's the pattern way. We don't come in with any, preconceived ideas here, except the quality of the data and the quality of the instruments and the math. But I have no idea. I feel like it's on a space trip or something. We're going to go somewhere together, and we're going to learn some things about people that we'd never learned before, and it'll be amazing to us, I think.
Well, we're exploring the world of humans.
Yeah. It's bigger than outer space.
It is.
In a way.
It is.
Well, I don't know. We have a little time, so if there are questions from anybody, happy to answer them. Lee can answer them. I'll watch. Mark?
Hi, Mark Mahan. I'm just curious if there is a successor to REveil. You put a lot of resources into that, and you actually, I think, analyzed far beyond what you actually told some of the REveil customers as well. So what's the situation?
So the situation is I was called about a month ago by I can't name multi-billionaire who said, I read your book, I've read all your papers, I'm convinced data-driven health is the future. I've raised a big healthcare fund, and I'm prepared to give you $500 million to do REveil right. So we're talking about how to go about doing that. And whether his view of REveil is the same as mine, because I'm not going to do it the wrong way.
Lee and I have talked at some length, I would say, about the idea that is a key pattern of the response variable in the data. And I believe that's part of the answer to your question, too. So in the doing of it right, to know exactly what question you want to have answered with data in the data set, which can provide that answer.
That's partly right, but the way I would say it, Mark, is any big company like REveil 2.0 that I start, I want it not only to deliver health to the individual, I want it to continue to invent the future, to get these new abilities to look into the complexity of the human condition and go way beyond the things we've thought about so far to optimize wellness and avoid disease. Yeah. And that's all possible. And you have to do it in a way that returns value to the investors. There's no question. But if you do it right, you're going to control and invent and delineate the whole future of healthcare for mankind.
And they're all going to need prospectral devices.
Absolutely. And they may need the computational tools you have too.
That's true.
We'll soon find out about those things. Yeah.
Tatiana Canzavelli. I'm the founder and CEO of Open Health Network, and I just want to applaud your efforts. And my deck back in 2013 had 360 degrees data that you mentioned that we need to analyze. And at that time, when I was speaking at Harvard, at one point back then, I said, I want to be treated by Watson, because healthcare is all about data. But I quickly realized that there are lots of data that can impact health. And the reason I started the company and got into healthcare in the first place, because I was diagnosed with cancer, and when asked why me, the response was, you're not lucky. And as a data scientist, I was like, that's
That's a technical term.
Right. So, we don't have data, right? So we had to build the whole framework to connect researchers with caregivers, with health coaches, patients, and data that comes from a variety of different devices and build data lakes. And we couldn't get to genomic database within the healthcare organizations. Even primary care people don't have access to all the data needed. So
Is this a question?
the question is, you mentioned few things that I'm wondering how much attention how much you integrate into your vision is behavior. So we realize that people might know everything, but if you're not integrating like certain behavioral methodologies such as motivational interviewing and such, people will not,
No, that
change
was
their-
really a fundamental part of Airvale in the beginning, is coaching and behavioral psychology. But I think you hit on another thing, and there are two aspects about the brain that are really important. One is cognition, and I think we have really great ways of assessing and optimizing cognition. And the second is essentially your mental state. And we have to be able
Right.
to deal with depression and the tendency to dive into addictions, alcohol,
Right.
drugs, and things like that. And there are really powerful new tools for doing that. And with Airvale 2.0, we're integrating all of those things in to what we didn't do with Airvale.
Yeah, we're just publishing research on this with UCSF and VA on AI tools in behavioral health for addictions. And the second part is that you touched a little bit on is neuroplasticity. You mentioned golf and tennis. And I submitted actually a proposal to ARPA-H on looking at games such as chess that highly complex in social games that can address a couple of issues. So thank you. And I think when we add all those pieces together, we'll get to nirvana of future
Thank
health.
you. Thank you.
We'll never
And we're-
reach it, but it'll be fun trying to.
Yes, we're at our time, Lee. So I want to thank you,
Okay.
and I look forward to getting on the spaceship with you and doing all this stuff together.
Great.